Okay, well, good morning. I guess good afternoon at this point. Thanks everyone for joining us, and thanks again for your patience as we got started a few minutes after the hour. I just want to go ahead and note that this session is going to be recorded and it will be made publicly available on our YouTube channel. I think, actually, I'm 100% sure I know everyone here today, but I'll just go ahead and introduce myself anyway. My name is Bailey Sterling. I'm the NNLM Region 3 Technology and LIS Coordinator, and I'm here with my co-host, Katie. Katie, did you want to introduce yourself?
Sure, yes. My name is Katie Pierce Farrier. I'm the Data Science Strategist for Region 3. And I've had the pleasure of working with Iram this past semester. So thank you so much.
Awesome. Thanks, Katie. Today, we are going to be seeing the NNLM Region 3 2022 Spring Internship Final Presentation of Iram Fatima from the University of North Texas. Iram will be showcasing the work she has done with our office over the last semester. In addition to our awesome student, the wonderful and supportive staff of NNLM Region 3 and Lewis Library. We also have with us Dan Burgard, University Librarian and Vice Provost for Scholarly Information Management. Dan is also the PI for NNLM Region 3. We have Brian Leaf, Executive Director of NNLM Region 3, and we have Dr. Anna Cleveland, Sarah Law Kennerly Endowed Professor, and Director of the Health Informatics Program at UNT. Dr. Cleveland, would you like to add anything before we get started?
Thank you very much, Bailey. I want to take this opportunity to thank NLM Region 3, and especially Brian Leaf, who have been our leader, as well as you and Katie Pierce Farrier, who has been supervising our intern this particular semester. I want to take this opportunity to state that the University of North Texas is very grateful for the support that they have gotten through the years from UNT Health Sciences Center Library. And of course, we had Don Bogart today representing the library. But also, since the library, the regional medical library, moved to Fort Worth, we're thankful for the time and effort that you have taken to share your experiences, your professional experiences with our students. We know that our program is much richer because we have this type of collaboration. And I'm looking forward to see the work that our present intern has done with you all. Thank you.
Thank you, Dr. Cleveland, and we appreciate our relationship with you as well. So thank you very much. I'll just go ahead and give a refresher. NNLM is, in short, the field force of the National Library of Medicine. We are focused on health literacy, progress in the field of medicine, and improving public health. We are a large organization divided into 7 regions, and we are Region 3 here, pictured in green on this map. We are a regional medical library, or an RML, that serves as like headquarters for that region, spearheading and managing outreach efforts. And in our case, that's among 7 states. Each RML serves their region in 5-year cycles. Of course, we are located at UNT Health Science Center Library in Fort Worth, where many of you work as well. Region 3, NNLM Region 3 serves the states of Arkansas, Louisiana, Kansas, Missouri, Nebraska, Oklahoma, and Texas. This month, we will hear from our 2022 spring interns, Iram Fatima and Amy Peck. Today, Iram is presenting, and you can catch Amy's presentation next Friday on April 29th. Iram and Amy have been working diligently all semester to complete their robust projects. Their substantial efforts have opened doors for future NNLM Region 3 outreach efforts and have allowed us to assess new avenues we can take to connect with all the varied populations we have in our region. In addition to their professional and academic responsibilities, they have consistently met with our Region 3 staff to carry out their internship duties. Iram's presentation today and Amy's next week fulfill their final obligations to our internship program. Today, Iram will share with us what she's been working on for the past few months in partnership with Katie Pierce Farrier, who you met at the beginning of this presentation, including a peek at the suite of NLM Product Educational Guides they have produced. This presentation will be immediately followed by a Q&A specifically with Dr. Cleveland, and then we will open the floor for everyone else to ask questions or offer comments. And feel free to unmute yourself or type your questions into the chat. With that, I will hand things over to Iram.
Thank you, Bailey, and good afternoon, everyone. A little bit about myself. I am Iram. I'm pursuing my master's in health informatics from UNT. And as Bailey mentioned, I have been interning at NNLM for the last few months, and my project was to develop educational guides for NLM products. Today, I will take you through Snomed CT guide. Oh, and just a disclaimer that this is funded by NLM. Hold on, I just need to put my, okay, got it. So the objective of my internship project is to provide a brief overview of the products in simpler language, highlight the usage of the product for targeted audience like researchers, information professionals, healthcare professionals, collaborate with information professionals to assess the efficiency and language of the guide and make revisions based on that, include real-life examples and a teaching example for better understanding. Some of the products that I worked on are Mesh, UMLS, RxNorm, and RxNav, and Snomed CT. And as I mentioned earlier, I'll talk about Snomed today. So Snomed International is an international nonprofit organization that engages with global healthcare community to improve health terminologies and clinical information. Their goal is to develop, maintain, promote, and enable the uptake and correct use of its terminology products in health systems and services globally. Snomed is the organization that maintains and distributes Snomed CT. Snomed International is the trading name of the International Health Terminology Standard Development Organization. IHTSDO, established in 2007. They're headquartered in London, UK. And Snomed CT, or the Systemized Nomenclature of Medicine Clinical Terms, is a comprehensive and multilingual standard health terminology consisting of clinical concepts, their descriptions, and relationships. It contains 300,000 medical concepts and is used in over 50 countries to electronically capture, record, and share clinical health information through EMR and EHR. Snomed CT also acts as a link between international terminology, classification, and code systems like ICD-9 and ICD-10. It facilitates semantic interoperability, and it is also used with other NLM products like RxNorm and LINC to cover medications and laboratory test needs. It enhances audit of care delivery by enabling detailed analysis of clinical records. And just for information, audit in healthcare is a process used by health professionals to assess, evaluate, and improve care of patients in systematic way. So we developed this guide for some targeted users, and these included healthcare organizations, healthcare professionals, information professionals, and researchers. Healthcare organizations use Snomed CT clinical concepts in EMR and map to other medical terminologies to facilitate enhanced health reporting, billing, statistical analysis. And Snomed CT is also used to help remove redundancies and irrelevant information, thereby achieving a greater revenue cycle efficiency and accuracy. Healthcare providers use Snomed CT for better interoperability, as it helps share patient information globally through a standard vocabulary. It also helps classify patient data into procedures, findings, anatomical concepts, supporting attribute type, and IT healthcare solutions that like Epic and Cerner, they closely work with healthcare providers, and they use a Snomed CT to index, store, retrieve, and aggregate clinical data across specialties. Well, information professionals use this product mainly to help patrons understand how to use Snomed CT and get licensed. They also work closely with researchers and medical students, and and they can help them identify clinical concepts and their relationships. Researchers use Snomed CT to help analyze big data in healthcare by identifying trends and drawing conclusions at both local and national levels. And they use it to understand the description of medical conditions, their complex interrelationships with each other. They also use it for demonstrations or evaluation purposes in medical informatics research. An example I'd like to talk about is when a researcher wants to understand all the different disorders caused by a very new ICD term called COVID-19. So they go to the Snomed COVID-19 guide and identify the Snomed CT mapping codes related to the term COVID-19 to see what are the different disorders or like different conditions linked to COVID-19. Key features, Snomed CT provides a standardized clinical vocabulary for EHR. ICD-10 is also another coding terminology, is then used to group similar concepts together for billing and reimbursement purposes. NLM offers free access to UMLS license holders. Licensees with UTS account, which is UMLS Terminology Services account, gets access to Snomed, RxNorm, and other terminology data files for free. The new terms are added frequently and released twice every year on January 31st and July 31st to keep up to date. Also, frequent update releases may cause some discrepancy in the clinical information as they may not be implemented and synced across the organizations at the same time. Healthcare organizations with different system suppliers like Cerner, Epic may not use the same formatting to store, retrieve, and process Snomed CT data. So I have included a teaching example to understand some features of Snomed. Here is the screenshot from the tutorial. So first, if we go to the Snomed homepage and search Snomed CT, we would see something like the screenshot on the right. And you can see users can choose from international editions or local editions. For this example, I went with local US edition. And then in the search box, I typed pneumonia and hit enter. I see 618 matches found, but not all of them are pneumonia disorders. Many are related to pneumonia, like different sort of pneumonias or procedures or diagnosis related to pneumonia. And on the screenshot I have highlighted, you can find the Snomed CT ID, SCT ID, the concept hierarchy, as in the parents, where it originates, and the children, basically. And on the top, highlighted in yellow, are the different tabs, like summary, details, diagram, expression, ref sets, history, etc. And on the left side, you can see a filter panel, which can be used to narrow down our searches. And I specifically went to the ref sets tab. We can find ICD-10 code here assigned to that particular concept. So for pneumonia, we see J18.9 is the assigned ICD-10 code. And then in the diagram tab, you can see their related concepts. However, if you notice, each one of them has different or unique SCT ID, which is the most important part because that's what's used when sharing health information. And here is a sample guide. This is how it looks in reality. Like we did it in a Word doc, and this is the formatting and template. Yeah, and that was all from me. So thank you so much for being here today. And before I let Bailey take over and open the floor for questions, I just wanted to take a moment to thank Dr. Cleveland, Katie, Bailey, Brian for providing me with this wonderful learning experience. This was truly an amazing opportunity, and I learned a lot through this internship, and I really, really appreciate each one of you for making it work. So thank you.
Awesome. Thank you so much for that wonderful presentation. Like I said, it's been wonderful working with you, and you've put a lot of great effort into this. And we were happy to have you on behalf of our RML. We were happy to have you with us. And so with that, I'd like to turn it over to Dr. Cleveland. If she has any final questions for you, then we'll open it up to everyone else.
Mm-hmm.
Thank you, Katie. I see that Brian has his hand up, so I'm going to defer the floor to him.
Oh no, that was the clapping emoji, not my raising emoji.
Thank you, Brian.
Well, first of all, of course, thank you to all of you and Katie. It's a wonderful moment to have you and Bailey, not only everybody else in the staff involved, because as my former student, both of you, I always say this is like a necklace. You know, it goes on. One pearl is another with another one. And it allows to work with NNLM and specifically the Region 3, but also with the Gibson Lewis Library that we have had. So I want to set that straight from the very beginning, that especially you two, is wonderful in this particular project that you're involved. So Iram, thank you for your presentation. Specifically, I enjoy looking and listening to the teaching examples that you have provided. Mm-hmm. So if we will ask you, what is it that you have learned from this experience? We want to hear what you have learned beyond SNOMED, because you were specifically dealing with this particular information source. And it's very important that you learn about the resources available from the National Library of Medicine,
right,
and the service that they provided. And you notice that you mentioned different clientele that it is. And that's important for us to realize that NLM has a much more holistic perspective than in the old days, that the clientele that they serve. So we will ask you what you have learned beyond SNOMED, working with this wonderful team that you have at NNLM.
Thank you for that question, Dr. Cleveland. And as you mentioned, I learned about these great resources that NLM offers, right, while working with UMLS or MESH or RxNorm or Snomed CT. So that was given. But one thing that I really want to point out is that, nowadays we have like a whole lot of information available or accessible to us within clicks, but not all these information are like meaningful. And as information professionals, we have to be like really thoughtful about that, because not everyone is going to use the information in the same way, and there's just tons of information out there. So someone needs to curate it and make it focused for targeted users, or just like we did for researchers and information professionals. And as like in related to like healthcare industry, I want to mention that this is really important step, because there are tons of information and misinformation, disinformation available online within clicks. But what is interesting, or what is most important, is that we curate it not only to like focus it to targeted users, but also have it present to them on a timely manner, because in healthcare industry, it can literally help them save lives. So that was something that I really learned, that although there are a lot of like information out there, not everything is within like the understanding of everyone, or like is for everyone. So it needs to be like narrowed down or like focused for different types of users. So yeah, that was my main takeaway, apart from learning about all these great resources.
I'm glad your comments, because for the audience, some of them, they know you bring a background in biotechnology. And many times we look at the healthcare industry and how is it that you can apply that knowledge that you have had. And we bypass information settings such as the library, such as NLM as an information agency, and to see how is it that your skills and knowledge from your subject domain can really apply, and you can contribute to us as much as we can contribute to you. And I think that that's a linkage that I have been making here that I think is very important as an example of it, of how it's this collaborative work. It can be have a successful outcome with a product like the one that you have presented today. So I think at this time that was my question. Do we have Brian or Bailey? I bring it back to you.
It's actually Katie is going to handle the Q&A, but I have a question for you, Iram. Actually, will you share with us, so you made this awesome SNOMED like educational guide. Can you share with us the other educational guides that you worked on this semester? Because it wasn't just this one, correct? Like,
No,
can you just tell us what they were?
Yes, so in my PowerPoint presentation, I worked with Mesh, and I worked with RxNav and RxNorm. I worked with Unified Medical Language System, UMLS, and I worked with SNOMED, International SNOMED CT. I'm also currently working with the database genotypes and phenotypes. So those were like the 5 projects I worked with.
And this is part of a suite of educational guides that you and Katie are working on, correct?
Right.
That's excellent. Okay, sorry, I'll pass it off to someone else who doesn't know more about this.
No, I want to take a minute to acknowledge Katie. I just had you in my screen, Bailey, and of course Ryan. But I do want to acknowledge the work that Katie had done, because you have been your immediate supervisor when it comes to the internship and develop this program, these particular guides that you have been doing to it. And I'm glad, Bailey, that you brought it up, that there was multi-guides. It's just that we are showcasing one today. So Katie, my thanks to you as well.
Thank you all. And like I said, we'll open the questions up to anyone. If you feel free to unmute or put them in the chat. And so we have an anonymous question. What were the challenges with determining needs and the relevance of the different audiences for each of the products?
I think the websites are really extensive, and there are tons of information available, but it's just like really time consuming and very complex. And the hardest part was to break it down into simpler language for different audience, because researchers might not use the product in the same way as an information professional or like as a healthcare organization. So that was the toughest part to kind of like pick those specific points that are relevant to each type of targeted users.
I think your point is very well taken about language and language literacy. I think, as a matter of fact, there's a project that I just hate to showcase Bailey, but again, she's working with a project for the Medical Library Association, the Research Training Institute, and representing as being selected one of our students for that particular RTI. And I would tell you that one of the things that she is focusing is in natural language. And what you have brought up is so much of a challenge for all of us. What is the language that a healthcare provider, somebody who has a subject domain expertise versus, the consumer health? And right. That's when I think that it becomes some of the challenges, right? For NLM products, many times do it, what is the focus? And people find it difficult to search because, as you say, is the language access to it, to go to the content on it. Yeah. So appreciate that comment.
I'm actually, I'd like to introduce myself real briefly. I'm Dr. Carol Perryman from TWU, right across town. And hello, everybody. So happy to be included in this. And thank you, Iram, for an excellent presentation. I'm really impressed with the work that you've done. It's definitely out of my realm of expertise. And what I've been getting more and more interested in, because I'm teaching medical librarians, is about informatics, medical informatics, specifically the involvement in medical librarians, especially in academic settings, in supporting and even conducting their own informatics research. So have you had thoughts, have you had exposure, or can you even address the idea of medical librarians and or medical library students in entering this realm in supporting researchers and practitioners using this. I can see that your effectiveness is very clear with regard to supporting the needs of medical students and researchers.
Yeah, so thank you for that question, Dr. Perriman. And yes, this is a great space, I think, and coming from, health informatics background with bioinformatics or biotechnology bachelor's, I do see a lot of common space and between the medical informatics and the researchers. So definitely there is a great opportunity for everyone to come together, especially in this, in this era where data science is just like taking over everything, and there still needs to be a lot of researches that needs to be done, and it needs a lot of collaboration, I would say, from as Dr. Cleveland mentioned earlier, that from experts, domain experts, from to information professionals, from researchers. So it needs a lot of collaboration, a lot of different expertise, and this is a great space to come together and collaborate and come up with even better outcomes. And actually, Dr. Cleveland is the professor for medical informatics, so I don't know if she has something to add to it. So yeah, Dr. Cleveland, if I missed anything.
Fantastic, thank you.
Hi, Carol. Wonderful to have you here.
Hello,
Want to
Anna.
welcome you. Yeah.
Thank you.
I think you have brought up a big challenge. Let's just say it's something that we look into it. And what we have done at TWU is that unofficially, but we have two tracks. One is the medical librarianship group, and then we have those that they are in health informatics. And we are creating an incredible master's program dealing with informatics and data science, where it's what we call patient-centric. So when we say patient-centric, is that we're looking also at information needs and information-seeking behavior of that patient and the health consumer at every aspect to it, from when we're dealing with admissions all the way to the EHR, or all the way to discharge, or whether we're dealing with wearables, every aspect that we're dealing with, it is patient-centered what we're looking at. So when you say what do we do with medical librarianship, what we're doing is being sure that there's a synergy, specifically in the classes. We acknowledge those people that come from the medical librarianship branch, that a lot of them, they come with the information seeking behavior, understanding of it, right? What is it that the patient wants? How is it that they look for information? They bring quite often background in the social science and the humanities to it. So what we're trying to do is to embed in those students the informatic data analytics right now. We're heavy on that aspect to it, but without neglecting every single one of those individuals. Like we have Iram comes on board about technology, and we have many students right now with the subject domain healthcare, physician, nurses, and all of that. We do not let them get out of our program without having a course that deals with evidence-based searching, for example, for health. And I know that you have a certificate on that.
Yes.
And and we do some of the other courses that they are aimed what we will call to the more medical librarianship aspect to it. So it is, when you say, how is it that you do? We try to bring these two people in the classroom. We do projects together that we can illustrate this synergy that can have all of this. So the people who come out and say, you're going to work in an academic health sciences center, hey, don't ignore all the researchers and also the informatic initiatives in your academic health science center. On the other hand, when we have these individuals that they come from, with the healthcare domain, that comes from those technical skills that they want, they're going to work in industry, and we have a number of them that they're going to work in industry. We say, hey, don't forget, the human interaction. How is it that you deal with searches? How is the usability of the information? And we make, because they have had the experience of working what we have called librarians and the technical side, how is it that they can work it together? We tell them, what is a systematic review? Hey, you cannot do it by yourself. Let me tell you how is it that you can do it. And then by having experience like today, what we're seeing today as an example of it, and the dedication. And I want to mention NNLM Region 3 and NLM. You know, I'm a great supporter of NLM. We show them how this cooperation can exist. So hopefully that helped you. And Brian, Iram, thank you for allowing me to speak and bring the perspective of how we are handling this at the moment. But like you said, it's challenging. We are all the time looking at it, you know, how we can do better, do better.
I appreciate that. And thank you. I definitely am a believer in sort of cross-boundary collaboration and the synergies that can be achieved right now, of course, but it's always been the case that we're looking for ways to work together. And I love the patient-centered or consumer-centered focus, because that seems directly appropriate to me. Thank you.
Awesome. Thank you guys so much again for everyone for joining us today. I think that's all the time that we have for questions, but please feel free to reach out to Bailey or I if you have any further questions. We'll be happy to help you and forward them over to Iram and to Iram. But thank you all for joining us today. Bailey, was there anything else that we needed to touch on?
I just wanted to tell Iram that you're free. You did it. You completed all of your requirements with our internship program. I have to say that I'm incredibly proud of the work that you have done in conjunction with Katie this semester. And I just love the growth that we have had the opportunity to see from you over the semester, but also over the past couple of years. So congratulations, you did it. And I just want to mention that Amy Peck from Texas Women's University will be presenting next Friday. And if you'd like more details on that, just shoot me an email. But thanks everyone for being here. We appreciate you. And congratulations, Iram.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.